Station 1370 WOCA.
Ocala.
All right, 5 minutes after 11 o'clock, Dr. Riadh Fakhoury is in the studio. And if you have a question for Dr. Fakhoury, don't wait to call, because when you get to the end, we have to rush and you get less of an answer. The phone number to call is the WOCA Climate Control Source Hotline, 352-622-9622. Dr. Fakhoury is a chiropractic orthopedist and is the owner of Fakhoury Medical and Chiropractic Center, where there are all kinds of professionals over there. And we've kind of understood that for a while now. We want to make sure we cover that a little bit today as well. But remember, your questions are invited, and we welcome your calls. Good morning, Doctor.
Good morning, Larry. How are you?
Pretty good.
Missed you last Wednesday.
Yeah. That was unusual for you.
Yeah, but hopefully some questions came in.
They did. The phone was ringing, and we kept saying, you got to call their office. You got to call the office if you have a question for this. And
well, today's live, so this is a great day for questions, isn't it?
Yeah. So can I tell you mine?
Yeah, please.
Now, I told you what it was. I didn't tell you where I got it from.
Okay.
Plantar, how do you say it?
Fasciitis.
Plantar fasciitis.
Right.
How you like my new shoes?
Very nice. I like that. That's a good-looking shoe.
That's a big shoe, right?
That's right.
It's
it
got
is.
a big foot inside of it, right? All right. Well, believe it or not, it's a little too big.
Okay.
So I said to the shoe lady, well, I like the shoe. I don't want to trade it in. I'll get an insert. And then when I went to the insert place in Walmart, they had these heels for plantar fasciitis.
Okay.
It sounded like political to me.
Well, we'll talk about that.
Talk about that after we get to this.
We've got a call already, so quickly.
You got one, yeah.
That's wonderful.
Good morning. You're on the air with Dr. Fakhoury.
Good morning, Doctor. I have a question for you about restless legs, severe restless legs. Is there a cure for this, and what is it?
Okay, thank you very much. The restless leg, for those, it's a syndrome, the restless leg syndrome. And when you are laying in bed, you just can't find a comfortable position. You just feel like you need to continue moving your feet and legs and trying to stretch them out. What you're doing is you're trying to improve the oxygenation of the legs. You're trying to improve the movement of good nutrition into the muscle and removing waste and toxins away from the muscle. And so your muscle is being irritated being irritated by a buildup of waste, and it could be circulatory in nature, and it usually is, and it's a matter that you're not getting proper circulation in your legs to be able to remove the waste product out of the muscles, and that increased waste product irritates your musculatures and causes them to cramp ever so slightly to a point where you feel like you need to stretch and move around. Sometimes it does come from your low back, and we find that when you manipulate, adjust, or realign the low back and make it work better, there's improved nerve supply and even circulation into the legs, which helps to reduce that syndrome or that symptomatology of leg discomfort causing you to move it. So it could be circulatory, or it can be what we call neurogenic, or originating from the nerves. If it's more from the spine, the adjustment and manipulation is very helpful with that. If it's more circulatory, then you need to get with your cardiologist or your GP, your primary care physician. Let them see if there's any type of circulatory situation that might be going on, not allowing a diffusion of capillaries into the muscles that will bring in oxygen and glucose and energy and take away the waste away from your muscles.
Will laser treatments help?
I'm not sure. I don't have enough experience to be able to answer that, and that is something that I'm not familiar with. And if I'm not familiar with it, I don't really want to comment yes or no. I'd say some more research on that would be good. See if there's any friends that have had laser surgery for restless leg syndrome, and I'm not too familiar with that. So to be comfortable in answering that, I'd rather defer to somebody who might specialize in that, or query your friends and just see what their experience has been.
Thank you so much.
Thank you very much. Thank you for the question.
Wow, who knew that toxins would cause that, huh?
Toxins are really an irritant, and they can be very, irritating to the muscle.
Yeah,
Then the muscle will react by tightening up and spasming.
Yeah. All right, let's go back to the phone. Somebody else is on the line. Good morning. You're on there with Dr. Fakhoury.
Yes, good morning, Doctor.
Good morning.
Keeping with the leg conversation, both my parents suffered from varicose veins, and now my sister has got that problem. And I've been lucky myself. I haven't had that much of a problem with it. And weight is not a problem, and I know that can cause it. Is there any application through your practice that could help prevent that in time?
That's an excellent question, and what we'll do is talk about what causes varicose veins. And varicose veins is a weakening of the walls of the veins. The veins will move the blood back to the heart, and they will start, let's say, from the feet and work up towards the heart. And there's little valves, check valves, in the veins. And when one of those valves gets damaged and can no longer hold that chamber, then the blood will rush down from that chamber and the chamber below. So now this lower chamber is holding 2 times the volume of blood that it should. So it stretches the wall out, puts stress on that valve. That valve fails, then all that blood will drop down into the chamber below. So now the chamber below is holding 3 times the blood that it should. And you can see how this perpetuates itself, stretching the wall of the veins, thinning the veins out, causing the possibility of inflammation of the veins, which is a phlebitis. And then when the blood stays stagnant, it could coagulate and thicken, which can cause thrombosis and secondary problems also. So some of the things that we like to recommend when somebody has a venous problem, and a circulatory situation like this is get them to exercise, get them to move, get the heart to stay strong so it can help to pump some of the fluid up against gravity. Get that person to move, because movement, you push the blood up the vein, up the chambers by the muscles contracting and squeezing. Like when your leg muscles squeeze and contract, your muscles are now pushing against the veins which are within that muscle, and that pushes the blood up to the next chamber and up to the next chamber. So exercise is very good. You don't want to be stagnant and just keep your feet dangling down, because then the fluid will just build up into those chambers and not move out. Get up regularly, walk, squeeze your muscles in your legs, push the blood up and out. A third thing that can be done is for those people with weakness of the walls of the veins and chambers that have collapsed because of weak valves, is wear support hose, and not just to the mid-thigh, but all to the mid-calf, but all the way up to the mid-thigh, so it pushes the blood all the way up, because now the support hose is doing the job of the muscles and squeezing the blood up the chambers and back towards the heart, so it doesn't stay stagnant like that. Now, when we are adjusting people and mobilizing the pelvis and realigning their pelvis and keeping it in an optimum position, that improves the circulation in and out of the legs also, because there's no restrictions, any type of anatomical restrictions affecting the flow of and the circulation of the fluids in the veins and in the arteries. So we find that manipulation not only helps reduce the pressure on the nerve, but also improves the circulation to a certain degree. But if it's damaged, you want to move it, you want to support it, you want to get up every now and then keep your legs elevated when you can also.
Is that a hereditary factor involved in that?
It can be. There can be some general weakness in the walls of the veins, and that could be, yes.
Now, I would imagine a person that's, let's say, a bus driver or an overland truck driver who are sitting most of the time, can they almost expect to have that problem, or can they avoid it by doing the things that you suggested?
Well, definitely the things that we suggested will be helpful to reduce stress on the veins and cause that damage to the valves and the stretching of the walls. But you're right. If you're sitting and you're not moving very much, you're more prone towards it. I find that a lot of ladies get varicosities after pregnancy, and the pressure of the baby, it's pushing pressure on the vena cava. The blood is being pushed back down into the leg and not allowed to be able to flow up towards the heart, and that puts an indirect pressure on the valves and damages the valves, and the varicosity can start from there.
Would you recommend like sleeping with your legs elevated?
That's a very good idea, yes, sir, because what that does, it draws the fluids and the blood away from the ankles, away from
Yeah.
the feet, and up towards the heart, which improves the circulation, because the body does better when it moves the fluids and the blood and circulates it better, the plasma, the blood.
Yeah.
It's so much better, the lymphatics. When that is flowing, your body performs much better. And
Right.
and case in point, the question just before the restless leg, if there's a circulatory problem, then that can cause the restless leg. But also, as we said, the poor circulation can cause varicosities in this scenario also.
Yeah, yeah. Okay, well, thank you very much.
Thank you. Excellent questions. Thank
Okay,
you very
bye now.
much.
Yeah, but and if I could just follow up a little bit on the restless leg with the toxin part of that. By the way, I'm not ignoring you. I'm trying to get this ready for the next call.
Okay.
Because the button's not working right. The presence of toxins causes the problem. The absence of them would fix it. Would the addition of like vitamins and things like that, like if you took, I don't know, some kind of a supplement, would that help?
Yes, yes. There are certain supplements that will help with oxygenation. There are certain supplements that will help. For example, let's talk about the simplest one that almost everybody knows about. If you're iron deficient anemia, if you have an anemia which is due to lack of iron in your blood, iron is a precursor or one of the components of hemoglobin, and hemoglobin is what carries the oxygen and helps oxygenate the tissues. So if you're lacking iron for whatever reason, maybe a slow bleed or maybe heavy cycles, whatever the scenario might be, that you'll feel more tired, more fatigued, your tissues won't get oxygenated, you'll get more toxic. And so in scenarios like that, taking iron improves the hemoglobin's capability of transporting more oxygen to the tissues. So that's a very simple example of how certain supplementation will improve the circulatory process and the perfusion of oxygen and ATP and glucose into the tissues versus and remove the waste out of the tissues also, because it drops the good and it picks up the waste and flushes it away.
Yeah, and I guess assuming that the toxins that we have in us are just, there's not a whole lot we can do about it unless we're just eating an abundance of junk. It sounds like the second caller's question really applies to the first caller, because if I guess if your legs are filled with toxins, and it's not really your fault, so to speak, you could just pump them out with exercise, it sounds like.
Yes, that's right, and improve the circulation, because when you're moving the circulation in your body then is the fluids are moving freely, then you're improving the circulation into the kidneys, better blood supply to the kidneys, better function of the kidneys will then filter your system and remove the toxins out of your systems more efficiently and out of your body.
Isn't it amazing how it all works?
One affects the other, and that's why the systems work hand in hand with each other, and if one is having a problem, the other could have a problem also. So let's say that we're not circulating our blood circulation is not as good as it should be. It's stagnating in the legs. We're getting some varicosities. There's irritation to the muscles. The heart, what is it trying to do? It has to get oxygen. It has to get blood back into a chamber to be able to pump it out, and then it has to go through that process to the lungs to pick up oxygen and back. So if it's not filling up because it's staying in the legs, then that heart is going to be under stress. It's going to pump differently. The muscle mass of the wall of the heart will thicken, thinking it has to pump stronger when that's not really the problem. So support hose, elevating, drinking more fluid, staying away from more toxic foods is a much healthier approach.
Okay, and do we do anything, I don't know if this even applies, but do we, or is this like a layperson's dumb question, do we do things to thicken our blood? And you would think that thick blood wouldn't pump as well, or is that just a misunderstanding?
Well, if you don't drink enough fluids, you're not hydrating your system, your blood has less fluid in it, so it's thicker. So that will thicken the blood. If you're stagnant, not exercising, don't get up, stretch, move around, then your blood becomes stagnant and does not flow. And just like a pond, if you just let it just sit and not circulate, it just sort of gets thick. And it's not a healthy scenario, because then that allows, if fibrinogen and other products in the blood to be able to start their clotting mechanism, because they're not, the blood's not flowing through like a river, but it's just stagnant. And just like bacteria will grow in a stagnant river, in a stagnant water, the blood will start thickening also, and it can lead to areas of clotting or buildup of materials on the walls of the blood vessels, which will then reduce the size of the lumen or the opening for the blood to be able to go through and cause stenosis or restriction of fluid movement.
There's a story last week about the more we learn about heart disease, the less we actually need to do open heart surgery. Did you see that story?
Right. It's really the more we know about our bodies and how to take care of them, the more we can avoid disease. And let's talk about an individual. We find a lot of people, Larry, that cannot exercise because their back is bothering them, their hip is bothering them, their knee is bothering them, the bottom of their foot, like plantar fasciitis, is bothering them. We have to resolve those issues, those musculoskeletal injuries, those musculoskeletal problems that they have. That pain is restricting them from being vital and active. And so what happens is they start getting secondary problems because of the lack of activity. Muscles atrophy, they lose their strength, circulation is poor, the joint doesn't get lubricated because it's not being moved as much. And so we see health decline when there's a lack of movement of exercise. So patients come to us sometimes just saying, I can't do what I want to do, and they actually want to be more active, so they come in for treatment to reduce the pain, to be able to increase their activity so they're more vital. And the body works better when it's moving and when it's exercising and when it's more active.
I actually heard an ad, and I think it was on our radio station, where there was a fundraising campaign to raise money to fight diabetes, and you pay and then you walk, and the slogan is "Walk to cure diabetes." And I thought, isn't that ironic? Because that's kind of what you've said. That walking, not just diabetes, but a lot of conditions.
That's true. And when you're walking and exercising, the heart is, when you're exercising, your blood vessels will dilate to open up to get more oxygen into the tissues, because you're demanding more, so the muscles want more oxygen, more energy, and they want to get rid of the waste, so the blood vessels will allow for that and open up. So imagine in a diabetic person, those toes and the feet that are not normally getting enough circulation, when you start walking, then you're opening up the blood supply and bringing good things to the tissues and keeping them healthy, and that reduces the chances of necrosis, which is a dying of the tissue, or if there's a nick on the skin, it'll accelerate the healing, so that way it doesn't become an ulcer. So there's so many benefits, and the more we look into it, the more we can see how interrelated it is.
Yeah, really.
And that walking, not only does it help in improving the circulation into the feet, but it's improving circulation to the kidneys, like we talked about also. And the kidneys are areas that are very vulnerable with diabetes, as are the eyes too. The lack of blood circulating into the back of the eye to the retina can cause some problems also.
Yes,
and
that's right.
Fatty build up in those blood vessels, the very tiny blood vessels, restrict the flow of blood in there. But when you're pumping and moving that, you're improving the circulation. So it's very it really encompasses a lot.
Just makes all the sense in the world. The phone lines are open. If you have a question for Dr. Fakhoury, feel free to call right now before we run out of time. But if we do run out of time, you can always call Dr. Fakhoury at his office. We'll give you his number at the end of the show. Right now, though, call Dr. Fakhoury on the air. The WOCA Climate Control Source hotline is 622-WOCA, 622-9622. And it looks like we have a caller. Doctor, good morning. You're on the air with Dr. Fakhoury. Are you there? I try again. Let me try this button over here. I apologize. There's a button issue going on. Good morning. You're on the air with Dr. Fakhoury.
Good morning, Dr. Fakhoury. Larry, one of the big things I think a person can do to help themselves as far as the toxins in your system would be the antioxidants. But I would caution that you make sure that you're getting the top quality, or the best you can find, simply because a lot of these supplement manufacturers don't do their quality control the way they should. And That's about all I have to say to it. I'm just wondering what the doctor has to say about that. And I'll hang up and listen. Thank you.
Thank you very much, sir. And you're exactly right, because like anything, when you're producing something, you can produce low quality product or very high quality product. Let's talk about what we just opened the show with, and that is Larry's feet and his shoes. And shoes are made from the most basic one you can pick up for $5 all the way to $200, and there's a different. It's not always how much you pay. The amount you pay is not always directly related to the quality of the item. You want to look at what you're buying, what you're purchasing, and that caller does an excellent job at saying, make sure you're buying quality, whether it's a shoe, whether it's an antioxidant. If you're putting money into something, make sure you're doing it wisely. Do your research. For example, you can get those simple, very basic Converse shoes that don't have any support in the arch, that really don't afford support to the foot. And they over time they can cause a breakdown of the foot, versus a shoe which has a much better support, better box, a wider platform to rest on. So with the vitamins, supplements, with the antioxidants, you want to make sure that you do your homework and get the best product possible, so that way your body will utilize that, and it'll be much more effective for you.
And going back to the plantar fasciitis, is that the correct pronunciation?
It is.
I don't think I have that, by the way. It's just that my shoe was too big. So I was thinking, okay, I'll just get one of those inserts. And I saw this hanging on the rack.
Right.
And I thought, is it possible that a little insert could actually fix somebody's foot? I thought, well, I know the guy to ask.
And it can. And one of the types of treatment we do for plantar fasciitis, along with the muscular work that we do at the bottom of the foot, because the fascia is the thick muscle on the bottom of the foot. It gets inflamed, it gets stretched, and so one of the main problems is the foot is flattened out, and it's stretching the fascia on the bottom of the foot, tugging away from the heel, causing that pain. So we'll actually put an insert, build an insert custom made to the foot to be able to support that. Now, I like the concept that you don't have the problem and you're preventing it by wearing a support shoe, a shoe with a good support underneath it. That's an excellent looking shoe. It's nice and wide. It's it's got a cushion on the bottom, so your heel strike is cushioned. So you're playing the preventive game. You're not going to wait to get it. So many people do get it. There's a physician that I know in Leesburg. He had to cut out one of the hospitals that he does rounds in because he couldn't walk anymore. The pain was so severe, and it affected his whole life. So we needed to build a plantar an orthotic or an insert that's made for his foot. We need to do some massage on the bottom of the foot, some ultrasound, some laser, whatever it takes to reduce the inflammation and support that fascia and relax it so it's no longer pulling away from the heel. And I like your approach. The preventive approach is the best approach. Now, I've got a word for you.
What is that?
Costochondritis.
Okay, was that with a C?
With a C.
Okay.
I'm wondering if anybody knows what costochondritis is. C-O-S-T.
So when you have an inflammation for buying too many things at Costco?
No, that's close, but it's C-O-S-T.
Oh, okay.
Costochondritis.
I don't know.
Well, costo means rib. Chond means cartilage. Itis means inflammation. So today I want to talk a little bit about what many people have, and that is pain in the chest where the rib and the cartilage come together right off the sternum. And so many people will have discomfort and pain, especially females.
Wow.
And sometimes it's also known as TC syndrome, and usually athletic females and sometimes younger females will have it more so. And I find that is becoming more common because people are becoming very active and moving the arms more, and quite often usually it's associated with a problem in the mid-back where the vertebrae shifts out of position. That individual will feel a stabbing pain in the shoulder blade or an irritating pain in the shoulder blade, radiates into the shoulder joint with a vague uncomfortable pain, and will wrap around to the front and cause a discomfort right off the sternum, about 1.5 inches off of the sternum, which could feel like something is out of position there. And you could actually move your hands up and down on either side of the sternum, and you could actually feel it out of position.
Well, any chest pain would be frightening, I would think.
It sure would be. If it's on the left side, if it's worse with exertion, if it moves up into the throat, you immediately want to get that evaluated and make sure that it's not a cardiac problem.
Wow, yeah, that's what happens. People get, they self-diagnose and either get it wrong or they don't. Good morning. You're on the air with Dr. Fakhoury.
Hi, Larry. This is June. Hi, Dr. Fakhoury.
Hi, June. Good morning.
How are you?
Great. How are you, dear?
I'm fine. I just wanted to tell you, about a year ago, I did have costochondritis, and I actually thought I was having a heart attack.
It's amazing how painful it can be.
That was painful. I went to the emergency room, and of course they diagnosed it as that. And it scared me, though. I just want people to know that
there you go.
It can mimic that, and it really, really scared me, but that's all it was.
Yes. And, you know, quite often, June, what happens is you go to the emergency room with this pain, and they'll do the testing, maybe keep you overnight, and then, you know, you'd be very fortunate if they say your heart is fine, everything is good, we can't find any problems. It's muscle spasms. And sometimes they'll use the word muscle spasms, but that is something that is more structural at that point. When they've ruled out a cardiovascular problem, then we know that it's more of a musculoskeletal problem, and a simple realignment of that vertebrae and the rib sets that rib back into the proper position and takes the pressure off and makes a tremendous difference. We see people confusing it when it's on the right-hand side, but it's so much less stressful when it is on the right side.
Yeah, right, because then you sort of know, right?
Because you know it's not the heart, unless you're one of the very, very few people that has reversed organs in your body, where the heart is on the right side instead of the left side, but that's extremely rare.
Now you're scaring everybody.
So
yeah, is that possible to have your heart on the wrong side, or are you just playing April Fools?
You don't have it on the wrong side. It's the right side for you, but you're just, some people, believe it or not, their entire organs are flipped, and their stomach is on the right side, and their heart is on the right side. They're just reversed. They're completely reversed with their organs.
Oh, I never knew that.
Right. So there's some. That's what you have to look
hang
for.
Up, Doctor. Thank you so much.
Thank you,
Bye-bye.
June. Thanks for your comment.
Yeah, I'm glad she called up, because I'm guessing a lot of people heard you say that, and either they're relieved because they say, oh, okay, well, I don't have a heart attack going on. Or
right.
Or
right.
I don't know.
But if it's on the left side, and if you feel, if it's with exertion, if it's going in the arm, if it's going up into the neck, then you better get it checked out. If you have a worry and if you have a fear, then get it checked. And if they clear it and say it's not your heart, then that's a good time to get in and get evaluated and see if it's a vertebrae out of position, a rib out of place, causing a costochondritis type pain.
And get it checked. I wanted to make sure that you mentioned real quickly, because I hinted at this at the beginning before we went on the air, that the Fakhoury Chiropractic or Medical and Chiropractic Center is not just about chiropractic.
Exactly.
You have other doctors there, too.
We do. We have an array of physicians, and that's why we are a multidisciplinary clinic, sort of a little different. We're not a chiropractic office. We're not a primary care office. What we are is a musculoskeletal center to take care of people that are having headaches, neck, back pain.
Yeah.
They've been in an accident. They've had some type of sports injury. If they have something lingering, that's what we focus on. If somebody's having a primary care situation, we'll refer it to their primary care. But in a scenario where somebody's having a musculoskeletal problem, we have an array of different physicians, wonderful physicians, be able to evaluate, find out what the cause is, and get it taken care of. And if it's something that we cannot take care of within our facility, making sure that individual gets to the right place so they can get taken care of.
Excellent. Good show as always. What is your phone number?
Well, the office number is 351-3413. Option 4 will take you directly to the front desk or our patient care coordinator, Amy, and we'll be able to answer any questions. And there's a lot of listeners I know that are having something going on. They're not quite sure what's going on, but they want some answers. They want at least to get it evaluated. They're welcome to come in. If it's more medical, we'll have Dr. Shanawani, our medical doctor, visit with you. If it's more chiropractic, we'll have Dr. Hutchison, myself, or Dr. Teeter, or Dr. Kim take a look and see what the situation is. But we'll get to the bottom of it.
Good job. Thank you, Doctor.
Thank you very
Always
much.
good to spend some time with you and learn a little bit, right?
Likewise. Thank you, Larry.
We'll take a little break and be right back.
Accident, injured, hurting. Pain affects so many of us and keeps us from enjoying our daily routine. This is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Let me visit with you to answer your questions. Let us help you help yourself on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA. Again, that's Dr. Riadh Fakhoury here to